Hello, everyone. Welcome to Pattern Differentiation according to Zhangfu organs. Today, we will discuss the lung and large intestine patterns. The lung, located in the upper jaw, connects with the windpipe or trachea and throat and opens into the nose orifice. It dominates dispersing, descending, depurating, and is related externally to the skin and manifests on the body hair. Its channel originates from the middle jaw and runs down to connect with the large intestine. The lung and large intestine are internally, externally connected. The main function of the lung is to govern qi and respiration. It inhales clear air and stores it in the chest to help produce zongqi or gathering qi, which assists the heart to push blood to the extremities. The lung also governs the regulating of water passages. This function ensures dispersal of qi and fluids to warm and moisten the skin and body hair and to regulate water passages. The function of the large intestine is to govern transmission and discharge of waste material. The pathological changes in the lung are mainly reflected in the functional weakness of the lung system, such as the hypofunction of respiration, disturbances in regulating the water passages, and lack of distribution of wei qi. So the lung governs qi and respiration, dominates dispersing and descending. If it is hypofunctional, this will result in qi shortage and a voice that is feeble. If the lung fails to govern dispersing and descending, this will lead to cough, asthma, shortness of breath, and chest pain. If the lung is unable or fails to disperse fluids, there will be fluid retention, edema. Insecurity of defensive qi or wei qi will lead to spontaneous sweating, aversion to wind, the tendency to catch cold. Failure of the lung to nourish the skin and body hair will result in dry hair and lusterless skin. Nasal functional weakness will lead to stuffy nose and runny nose and sneezing. If the throat is affected, there will be itchy throat, sore throat, hoarseness, loss of voice. And finally, if the large intestine is unable to transmit and discharge waste material, there will be constipation or diarrhea. The lung patterns can be classified into two types, deficiency and excess. Deficiency is caused by deficiency of qi or deficiency of yin, which occurs in chronic diseases or chronic cough or in Zhangfu impairments, while excess results from invasion of wind cold, dryness, heat, or retention of fluid in the lung. Etiology and pathogenesis of lung patterns. So for invasion by exterior pathogens, we have wind cold, wind heat, dryness, cold, and wind cold or wind heat can turn into heat. A depressed and stagnated pathogen will turn into heat as well, so leading to phlegm heat obstructing the lung. Or these pathogens can scorch body fluids to form phlegm. Now, long-standing phlegm turns into heat, therefore leading to phlegm heat obstructing the lung. Cold, damp, coupled with spleen-qi deficiency will lead to phlegm dump obstructing the lung. If one has chronic cough, it can damage the lung. Combined with spleen-qi deficiency will lead to lung-qi deficiency, which can consume the qi. If one has TB, tuberculosis, one can have lung-yin deficiency. Let's talk about wind cold invading the lung. An invasion of wind cold is an acute pattern that does not usually last for extended periods of time. The wind cold either being quickly expelled from the body or transforming into heat and penetrating deeper into the body. It is nevertheless important to diagnose and treat this condition correctly. Furthermore, it is important to remember that it is the symptoms that define a pattern of imbalance. If a person manifests with symptoms of wind cold, then there is wind cold. This is relevant, for example, in the diagnosis of hay fever and other allergic reactions. So the concept here is wind cold invading the Weiqi level of the lung system and impairing the lung dispersing function. The key symptoms for wind cold invading the lung are cough, clear watery sputum, along with symptoms of an exterior wind cold pattern. Clinical manifestations are cough, clear watery sputum, aversion to cold with slight fever, stuffy nose with clear watery mucus, absence of sweating, head and body pain, thin white coating, a floating and tight pulse. Analysis, this pattern is mainly caused by the exterior wind cold pathogen invading the Weiqi level of the lung system and impairing the lungs dispersing function. There will be a powerful CHI or pathogenic factor that has been potent enough to pierce the body's Weiqi. The invasion can arise if the person has been exposed to climatic wind or cold, but it can also arise after exposure to artificial air conditioning. Furthermore, some allergens and pollutants can also provoke a wind-cold pattern of imbalance. There may be an underlying Weiqi deficiency, which means the pathogenic factor does not require the same strength to be able to penetrate the body's defenses. So the etiology is exposure to exterior wind and cold, relative weakness of the body's qi in relation to the pathogenic factor. Signs and symptoms, again, would be aversion to cold, fever, cough, itchy throat, slight breathlessness, stuffed or runny nose with clear watery discharge, sneezing, occipital headache, body aches, absence of sweating, heavy voice, itchy throat, cough, absence of thirst. And of course, the pulse would be floating and tight. Tongue has thin white coating. Treatment principle is to dissipate wind cold, diffuse the lung, and suppress the cough. Acupuncture treatment, we use lung 7 to release the exterior, expel wind. Gallbladder 20 to expel the wind, as well as do 16. Bladder 12, we use cupping to expel wind and to release the exterior. Sanjiao 5 to expel wind, and this can benefit the head. We use Li4 to release the exterior and bladder 13 to suppress the cough, regulate the lung qi. We needle using drainage or sedation. If there is headache, we add DO20 and Si3. For absence of sweating, we add kidney 7. If there is nasal congestion and runny nose, we add Li20 and the extra point intan. For cough, we add bladder 13 and bladder 11. When there are invasions of wind cold, it is advisable to consume beverages that are hot and spicy to open the exterior and expel the qi. This could be, for example, ginger, garlic, whiskey, brandy, or chili. Fasting is also advisable, or only eating soup such as onion soup. There are two reasons for this. First, when temporarily fasting, qi will not be used to transform food and therefore can be used to combat the invading pathogenic factor. Second, some sources say that the downward movement of food and qi in the stomach can draw the exogenous pathogenic qi inwards from the surface. Next, we discuss wind heat invading the lung. Like an invasion of wind cold, an invasion of wind heat is usually an acute pattern. While an invasion of wind cold will often, but certainly not always, arise from climatic influences such as cold or droughts, An invasion of wind heat can be caused by exposure to climatic influences and also by infectious pathogens such as bacteria and viruses. Where wind cold invades the body via wei qi in the skin, wind heat can also invade the body via the mucous membranes in the nose and mouth. Again, allergens and other influences from the outside of the body can give rise to wind heat reaction, and it is the symptoms and signs that define the pattern. The concept, wind heat pathogen invading the wei qi level of the lung system. Key symptoms, cough, and symptoms of exterior wind heat patterns. Clinical manifestations, cough with sticky yellow sputum, stuffy nose with thick yellow nasal discharge, fever with slight aversion to wind cold, slight thirst or sore throat. The front of the tongue is red with a thin yellow coating and a floating and rapid pulse. This pattern is mainly caused by the exterior wind heat pathogen, which invades the wei qi level of the lung system. Exposure to climatic factors or to bacteria, viruses, allergens, and so on that have wind heat dynamic. There may be an underlying lung qi deficiency, which makes it easier for exogenous pathogenic qi to invade the body. So the etiology, exposure to climatic wind and heat, possible weak wei qi. Signs and symptoms, again, cough, fever, aversion to cold, scorching, sore throat, stuffed nose without snivel, cough with yellow mucus, headache, body ache, slight sweating, thirst, swollen tonsils, slight aversion to cold. Pulse will be floating and rapid. Tongue will have red sides or tip. The coating may be yellow or yellowish white and thin. Treatment principle, release the exterior, expel wind heat. Acupuncture treatment, we use lung 10 to clear lung heat, Li 11 to release the exterior and to clear the heat. We also use lung 11 to clear lung heat, bladder 12, cupping, expels wind. Gallbladder 20 will expel the exterior wind, lung 5 will clear the phlegm. Li 4 to release the exterior and clear the heat, stomach 44 to descend stomach qi, 214 to clear heat, 216 to expel exterior wind, and Sanjiao 5 to expel wind and clear heat. We needle with drainage or sedation. For headache, we add Du20, Taiyang, and Si3. For spontaneous sweating, we add the points Li4 and kidney 7. For nasal congestion without snivel, we add Li20 and Intang. For scorching sore throat, we prick lung 11 to bleed. For cough with thick yellow phlegm, we add bladder 13, Li4, and lung 7. When there is an acute invasion of exogenous pathogenic factor in the exterior, it is advisable to consume beverages that are cooling and spicy, such as mint, chamomile, chrysanthemum, or elderflower to open the exterior and expel wind heat. Fasting is also advisable. Fasting temporarily means that qi will not be used to transform food and can therefore be used to combat the invading pathogenic factor. Furthermore, some sources are also of the opinion that the downward movement of food and qi in the stomach created by eating food can draw the exogenous pathogenic factor inwards from the surface. Next, we talk about dryness invading the lung. Cough with little sputum plus exterior syndrome. This is the lung dryness pattern or invasion of the lung by dryness. The dryness includes warm dryness and cool dryness. Warm dryness usually occurring in early autumn and cool dryness in late autumn. The dryness damages the body fluid in the lungs, which then fail to dominate descending, causing a cough with thick, sticky sputum and a dry mouth, lips, nose, and throat. Concept, this is due to an exterior dryness pathogen in autumn, which invades the Wei Qi level and also injures fluids of the lung system. It is also called dryness invading the lung pattern. It is divided into two types, warm dryness and cool dryness patterns, according to whether the dryness pathogen has a propensity to warm or cool. Key symptoms, lung system diseases, along with a dryness and scanty fluids pattern. Clinical manifestations, dry cough with scanty sputum or sticky sputum that is difficult to expectorate, or even chest pain, sputum with blood, dry mouth, lips, nose, and pharynx, or epistaxis, nose bleeding, hemoptysis, dry stool and scanty urine, a thin dry tongue coating with little fluids, fever, slight aversion to wind cold, no sweating or scanty sweating, a floating and rapid or floating and tight pulse. This pattern is mainly caused by the dryness pathogen invading the lung and injuring lung fluids, leading to disharmony of Wei Qi, or by the wind heat pathogen turning into dryness and injuring fluids. Dryness in early autumn has a tendency to warmth. As a result, most diseases during this time have a leaning towards warm dryness, while dryness in the late autumn has a tendency to be cool. And so most diseases then are leaning towards being cool dryness patterns. The lung qi is defensive. The invasion of dryness causes fever and an aversion to cold because the defensive qi is damaged. The cool dryness is associated with the tendency of cold, so its manifestation is similar to wind cold, while the warm dryness is associated with the tendency of heat, so its manifestation is similar to wind heat. The dryness transformed into fire that damages the vessels of the lungs, results in chest pain and hemoptysis. The dryness injuring the body fluid of the lungs results in a dry tongue coating. In most cases, the pulse is rapid when the dryness injures the lungs. So etiology, exposure to climatic wind and heat. Signs and symptoms, again, dry cough without phlegm or with scant sticky phlegm not easily expectorated, aversion to cold, fever, dry throat, tickly throat, dry nose, dry lips, discomfort in the chest. Pulse is floating, tongue is red with yellow or white fur or coating. Treatment principle to clear dryness, moisten lung, suppress cough, transform phlegm. Acupuncture treatment, we use lung 7 to release exterior and expel wind, Sanjiao 5 to expel wind and release exterior, spleen 6 to supplement the body's yin, bladder 13 to supplement lung qi, Li4 to release exterior, Ren 12 to descend rebellious qi, bladder 12 using cupping expels wind, kidney 6 to disinhibit the throat. We needle with drainage. For generalized sweating and aversion to cold, we drain bladder 12, gallbladder 20, and bladder 11. When it comes to overcoming the effects of dryness in TCM, incorporating certain foods into your diet can be incredibly beneficial. These natural remedies help replenish the qi and nourish the body to counteract the drying effects of external internal dryness. White fungus, also known as tremella, is a popular ingredient in TCM for moistening the lungs and relieving dryness and itchiness. It is rich in amino acids, which help moisturize the skin and improve hydration, giving it a radiant glow and elasticity. You can incorporate tremella into your diet by adding it to sweet soup such as longan tremella soup or rock sugar pear with tremella soup, both of which are not only delicious but also highly beneficial for combating dryness. Chinese yam is another fantastic ingredient for nourishing the lungs and adjusting metabolism. It is a perfect example of food and medicine coming from the same source. Chinese yam can be consumed raw or cooked in soups. It aids in nourishing the lungs, regulating metabolism, and the best part is it is low in starch, so you don't have to worry about gaining weight while enjoying its wonderful benefits. Lotus root is known for its ability to clear heat and nourish the spleen and stomach. In TCM, raw and cooked lotus roots have different properties. Raw lotus root can effectively cool the blood, disperse blood stasis, and clear internal heat, making it suitable for those experiencing dry mouth and excessive internal heat. Cooking lotus root strengthens the spleen and stomach, nourishes qi and blood, and stops diarrhea, making it a great option for those with weak digestion. Pears have long been regarded as a beneficial fruit in TCM for moistening the lungs and stomach, as well as clearing heat and transforming phlegm. Ancient texts recommend pears for treating symptoms like dry cough with little phlegm, dry throat, and hoarseness. Fresh pear juice with honey is excellent for moisturizing the throat, while a stewed pear dish with rock sugar and fritillaria can effectively alleviate coughs and promote throat health. And finally, we have the lily. Lilies have remarkable properties for moistening the lungs, stopping coughing, calming the heart, and soothing the spirit. These slightly sweet and bitter-flavored flowers work wonders for maintaining respiratory health and treating coughs caused by dryness. For those who often suffer from insomnia and related symptoms, lilies can be highly effective in promoting restful sleep and calming the mind. Now let's talk about cold pathogen congesting the lung. Lung yang deficiency is seen when the lung lacks the necessary activating heat to perform its activities and functions. It is a pattern that is not commonly described or listed in many textbooks, its symptoms and signs being attributed to the combined pattern of lung qi deficiency and kidney yang deficiency. Treating these two patterns simultaneously will also provide excellent results. So the concept here is due to a cold pathogen congesting the lung. Key symptoms, sudden cough and dyspnea, accompanied by cold signs. Clinical manifestations are cough, dyspnea, white watery sputum, cold body and limbs, pale tongue with white coating, and a slow and moderate pulse. This pattern manifests as a sudden onset of cough and dyspnea, accompanied by a cold pattern as a diagnostic indicator. Lung yang deficiency will arise from the same etiological factors that cause lung qi deficiency. Factors such as repeated invasions of exogenous cold, overexertion, and consuming cooling foods will often be involved. So let's summarize lung yang deficiency. Etiology is hereditary weakness, poor posture which constricts the breath, exposure to cold, prolonged grief and sadness, weakening the lung qi, repeated impairment of lung qi, diffusing and descending function over a long time, and spleen or kidney yang deficiency. Signs and symptoms, again, shortness of breath, panting, worse on exertion, forceless cough with profuse watery sputum, weak voice, bright white complexion, spontaneous daytime sweating, dislike of speaking, easily catches colds, tiredness, dislike of cold, feeling of cold, cold hands, cold feeling of upper back, and absence of thirst. The pulse is weak, especially the right front position. Tongue is pale, slightly wet, white coating. Treatment principle, warm and supplement the lung yang. Acupuncture treatment, we use lung 9 to supplement the lung yang, Ren 6 to supplement original qi and fortify the yang, Du 12 to relieve cough and dyspnea, Ren 12 to supplement earth to strengthen metal, Bladder 20 to supplement the spleen, Lung 7 to promote descending of lung qi, Bladder 13 to supplement lung qi, Stomach 36 to supplement stomach and lung qi, Bladder 43 to supplement the lung, and spleen 3, the source point of the spleen. We needle with supplementation or reinforcement and large amounts of moxa. In addition to the advice that is relevant for lung qi deficiency, it is important that the person keeps warm, avoids consuming cold foods and drinks, both physically and energetically cold, and does not overexert themselves physically. They will benefit from getting enough rest and drinking ginger tea. Next, we talk about phlegm damp obstructing the lung. This pattern can occur when the chi mechanism of the lung is disrupted by repeated invasions of exogenous pathogenic chi, or when the spleen is not able to separate the pure from the impure, resulting in damp and phlegm arising in the middle jaw, which are then sent upwards along with the pure gu qi to the lung. According to Chinese medicine, phlegm is created by the spleen and stored in the lung. This means that in chronic conditions, when there is damp phlegm in the lung, the spleen must also be tonified at the same time. The presence of damp phlegm will block the spleen and lungs chi mechanism, and this blockage can then lead to the further formation of phlegm dampness. Concept, this is due to spleen chi deficiency or chronic cough damaging the lung, or a wind cold damp pathogen invading the lung, all of which lead the damp phlegm to obstruct and stagnate in the lung. Key symptoms: cough with profuse white sticky sputum that is easy to expectorate. Clinical manifestations: cough with profuse white sticky sputum that is easy to expectorate, chest stuffiness, even asthma and wheezing, pale tongue with white greasy coating and a slippery pulse. This pattern can be seen in both acute and chronic diseases, however, mostly seen in chronic diseases. Damp phlegm in the lung can arise from invasions of exogenous pathogenic qi that disrupt lung qi and block the transformation and spreading of fluids. Spleen qi deficiency and dampness are often at the root of an accumulation of damp phlegm in the lung. The spleen is particularly burdened when the diet contains a lot of food that has a cold or damp energy, or when the food and liquids consumed are physically cold. The pattern can also arise through the use of medicines that are energetically cold. Posture can be a contributing factor. If the person has a tendency to sit stooped or slumped, it will block both the spleen and lung chi mechanisms. This will lead to the formation of damp phlegm in the middle jaw and the accumulation of damp phlegm in the upper jaw. Emotional factors such as sorrow or worry can affect the lung and spleen, and this may be a contributing factor to this pattern. So again, the etiology of phlegm dump obstructing the lung would be invasion of exterior cold, poorly expelled, overexertion and poor diet over long period, excessive consumption of greasy or cold raw foods leading to phlegm dump production by spleen, settling in the lung, chronic spleen, or lung yang deficiency. Signs and symptoms: cough with easy expectoration of watery white sputum, aggravated by exposure to cold, aggravated by physical movement, feeling of cold, cold hands, phlegm in the throat, dizziness, feeling of fullness and oppression in the chest, feeling of cold in the chest. Pulse is slippery and slow. Tongue swollen and wet tongue, sticky white coating. Treatment principle: transform phlegm dump, regulate waterways, descend lung qi, suppress the cough. Acupuncture treatment: we use lung 5 to clear phlegm from the lungs. Ren 17 to supplement lung qi. Bladder 13 to supplement also lung qi. Ren 22 to diffuse the lung, transform phlegm. Li 4 to release the exterior. Pericardium 6 to loosen the chest and rectify the qi. Lung 7 to descend lung qi. Ren 12 to resolve phlegm. Bladder 20 to supplement spleen and resolve phlegm. Spleen 3 to support the spleen. Lung 9 supplements lung yin, and stomach 36 to transform damp. Needling, even method. It is essential that the person with damp phlegm in the lung avoids consuming damp and phlegm-creating foods and beverages, especially dairy products, sweets, wheat, sugar, bananas, avocados, dried fruit, and so on. They should also avoid consuming cold, refrigerated foods, foods that have not been cooked, and eating regularly, as this eating irregularly, no? As this will strain the spleen and can lead to formation of dampness and phlegm. Correct body posture and exercise are important in order to avoid stagnation, and blockage of the Qi mechanism in the upper and middle jaw. Repeated invasions of exogenous pathogenic factor can be a contributing factor in the formation of dampness and phlegm in the lung. This means that the patient must make sure that they are suitably dressed and do not expose themselves to invasions of exogenous pathogenic Qi. Beating the chest and the upper back with a loose fist or a wooden spoon will help to activate Qi in the chest and thereby help to resolve stagnations of phlegm and dampness. We now discuss heat pathogen congesting the lung. This can be both an acute and a chronic pattern. Acute patterns will be caused by invasions of exogenous pathogenic Qi that have penetrated into the Qi level. Concept, this is due to a heat pathogen congesting the lung. The invasion of the lung by a heat pathogen impairs the lung's dispersing and descending functions and manifests as excess heat along the lung channel. It is also called a lung heat pattern or lung fire pattern. It belongs to the Qi level pattern of the Wei Qi Ying blood pattern differentiation. Key symptoms, symptoms of lung diseases, and symptoms of interior excess heat. Clinical manifestations are fever, thirst, cough, dyspnea, nostrils, flaring, chest pain, red, swollen, and sore throat, scanty, deep red urine, constipation, red tongue with a yellow coating, a rapid pulse. This pattern is mainly caused by the wind heat pathogen invading the body or wind cold pathogen invading the body, then transforming into heat and congesting in the lung. Invasions of exogenous pathogenic Qi can directly generate heat in the lung. So smoking or exposure to tobacco smoke can also create lung heat. Ingestion of food and beverages that are hot can indirectly create heat in the lung. So to summarize, etiology of lung heat is interior heat from yin deficiency or Qi stagnation, from chronic emotional strain, invasion of external pathogenic heat. Underlying pathology is lung yin deficiency, invasion of lungs by wind heat, lung Qi stagnation. Signs and symptoms, cough, slight breathlessness, feeling of heat, chest ache, flaring of the nostrils, thirst, and red face. Pulse is overflowing and rapid. Tongue is red with yellow coating. Treatment, enrich the yin, clear the lung heat. Acupuncture treatment, we use lung 5 to clear heat from the lungs. Lung 7 to restore the lung descending function. Lung 1 to descend lung Qi, alleviate cough. Bladder 13 to supplement lung Qi. Lung 10 to clear heat from the lungs. Li 11 to clear heat, or needled with reduction or sedation techniques or drainage. A person with heat in the lung should avoid eating or drinking anything that has a hot dynamic. Tobacco smoke is hot and drying, so the person should avoid exposure to this. Now let's talk about phlegm heat obstructing the lung. Phlegm heat in the lung will often have developed from other lung imbalances. Damp phlegm in the lung can easily transform into phlegm heat in the lung because either there is already heat in the lung or the stagnation that is created by the phlegm will generate heat in the lung. The difference between this pattern and damp phlegm in the lung is that there are heat symptoms and signs. The pattern of lung heat can also be a precursor of this because heat in the lung can condense fluids and thereby lead to the formation of phlegm heat. It is important to note that phlegm heat does not necessarily manifest with yellow or green sputum. The sputum can be white, thick, and sticky. This is due to the heat condensing fluids so that they become thick and sticky. When the phlegm is yellow or greenish, the heat will be more intense. Concept, this is due to phlegm combined with heat obstructing the lung, which leads to impairment in dispersing and descending functions, and consequently manifests as excess heat along the lung channel. Key symptoms: cough with profuse sputum and symptoms of interior excess heat. Clinical manifestations are cough with profuse yellow thick sputum, chest stuffiness, dyspnea, nostrils flaring, gurgling sound in the throat, vexation and restlessness, fever, thirst, cough, and expectoration with foul smelling, pus-like sputum with blood, chest pain, constipation, scanty dark urine, red tongue with yellow greasy coating, a slippery and rapid pulse. This pattern is mainly caused by pathogens invading the lung and then stagnating and subsequently turning into heat, which injures lung fluids to form phlegm. Alternatively, it can be caused by long-standing phlegm turning into heat, both of which combine together and obstruct the lung. Phlegm heat in the lung can arise if there is an excessive consumption of foods that create phlegm or heat. Examples of these foods are dairy products, sweet, sugar, alcohol, wheat, fried food, too much red meat, spicy food, and chocolate. Very cold food and beverages or raw vegetables can be involved indirectly because they can weaken spleen yang and qi, thereby leading to the creation of dampness and phlegm. Invasions of exogenous pathogenic qi can create both phlegm and heat in the lung. Air pollution, especially tobacco smoke, can be an important etiological factor. This is seen in many people who smoke tobacco developing a smoker's cough, having difficulty breathing and easily becoming breathless. Stress can create heat in the body, and emotions such as anger, irritation, and frustration can generate heat in the liver that then rises to the lung and creates heat here. So the etiology of phlegm heat obstructing the lung is invasion of exterior heat depressed in the lung and transforming into heat. Internally produced heat from yin deficiency or qi stagnation, from long-term emotional strain, excessive consumption of greasy and cold raw foods. Possible presenting condition would be bronchial asthma, acute bronchitis, pneumonia, pulmonary emphysema with infection. Signs and symptoms are cough and panting, barking cough with profuse sticky yellow or green sputum, shortness of breath, sweating, flaring nostrils, expectoration of blood and or purulent phlegm with fishy smell, wheezing, feeling of oppression of the chest, feeling of heat, thirst, insomnia, agitation. Pulse, slippery, rapid. Tongue is red, swollen with a sticky yellow coating. Treatment principle, clear and drain phlegm heat. Acupuncture treatment, lung 5 to clear heat and phlegm. Lung 10 to clear lung heat. Bladder 13 to supplement lung qi. Stomach 40 to resolve phlegm. LI 4 to release the exterior. Stomach 36 to transform phlegm. Lung 7 to restore lung descending function. LI 11 to clear lung heat. REN 12 to supplement spleen, resolve phlegm. Lung 1 to descend lung qi and alleviate cough. REN 17 to unbind the chest, and kidney 6 to disinhibit the throat. Needle with drainage. We prick LI1 to bleed. A person with phlegm heat in the lung should avoid consuming food that creates heat, dampness, and phlegm. This includes dairy products, sweets, dried fruits, sugar, alcohol, fried food, chili, pepper, garlic, chocolate, and lung. Smoking should be discouraged, and the person should avoid other forms of air pollution. Next is lung qi deficiency. Lung qi deficiency can arise independently, but will most often be seen together with spleen qi deficiency or heart qi deficiency. When there is lung and spleen qi deficiency, there will be a general condition of qi deficiency characterized by poor production of qi, whereas lung and heart qi deficiency will be a more emotional imbalance with sorrow, grief, and a lack of joy as the dominant symptoms. Concept, this is due to a declining function of the lung, in governing qi and dominating the weight defensive function. Key symptoms: weak cough, dyspnea, low voice, and clear watery sputum with other symptoms of qi deficiency. Clinical manifestations: weak cough and dyspnea, shortage of qi, shortage of breath, which is worse on exertion, clear watery sputum, low voice, spontaneous sweating, aversion to wind, a tendency to catch cold, mental fatigue, tiredness, pale complexion, pale tongue with a white coating, and a weak pulse. This pattern is mainly caused by chronic cough, damaging the lung qi, or spleen deficiency unable to transform sufficient food into essence qi for nourishing the lung. Lung qi deficiency can be caused by a respiratory illness in childhood. Poor posture, where the person sits slumped forwards, can inhibit the qi mechanism of the lung and thereby weaken lung qi over time. Furthermore, a lack of exercise will mean that the qi mechanism in the upper jaw is not supported by physical movement. Lung qi can be weakened by repeated invasions of exogenous pathogenic qi, or if there has been an invasion of exogenous pathogenic qi that has not been properly resolved, for example, through the use of antibiotics. The lung is emotionally affected by grief, sorrow, and melancholy. If the person has experienced repeated or excessive grief and sorrow, especially if the grief remains unresolved, it will bind and weaken lung qi. Lung qi is weakened by excessive talking or singing. This is because zong qi is used to create the volume of the voice. This means that teachers, lecturers, actors, and singers can have a tendency to develop lung qi deficiency. Excessive consumption of spicy food can spread and expel lung qi through the pores in the skin. Lung qi can be an aspect of other qi deficiency patterns, and therefore their etiology can also be involved in the generation of lung qi deficiency. So the etiology of lung qi deficiency would be hereditary weakness, poor posture which constricts the breath, exposure to cold, prolonged grief and sadness weakening the lung qi, repeated impairment of lung qi diffusing and descending over long time. Signs and symptoms: shortness of breath, panting, worse on exertion, forceless cough with profuse watery sputum, weak voice, spontaneous daytime sweating, dislike of speaking, pale or bright white complexion, easily catches colds, tiredness, dislike of cold, feeling of cold, cold hands, cold feeling of upper back, absence of thirst. The pulse is weak, especially the right front position. Tongue is pale, slightly wet, white coating. Treatment principles: strengthen the lung qi, support defensive exterior. Acupuncture treatment: Lung 9 to supplement lung yang, Ren 6 to supplement original qi, fortify yang, Du 12 to relieve cough and dyspnea, Ren 12 to supplement earth to strengthen metal, Bladder 20 to supplement the spleen, Lung 7 to promote the descending of lung qi, Bladder 13 to supplement lung qi, Stomach 36 to supplement stomach and lung qi, Bladder 43 to supplement the lung, and Spleen 3, the source point of the spleen. We needle with supplementation and use moxa if required. Because this is a qi deficiency condition, the advice given for spleen qi deficiency and kidney qi deficiency will also apply here. That is, the person should eat a diet that is nutritious but does not weaken the spleen. Food that is white in color will often have an affinity with the lung and can be used to focus qi tonics on the lung. The person should avoid consuming food that is very spicy because it will spread and thereby weaken lung qi. Foods that particularly strengthen lung qi are turnips, daikon, radishes, parsnips, parsley, onion, garlic, tofu, herring, walnuts, almonds, cauliflower, dates, figs, duck, tuna, grapes, thyme, and ginseng. Ginger tea will also be beneficial. It is important that a person who is lung qi deficient does not strain their voice because it will weaken the lung qi. A person with lung qi deficiency must ensure that they get enough rest and do not overexert themselves. However, light exercise and movement will be beneficial because they will open the chest and support the lungs' qi mechanism. Going for walks in fresh air will be salutary because the person will get some light exercise and the fresh air will nourish the lung. Yoga and Qigong often utilize breathing exercises that have a beneficial effect on lung qi. It is important that a person who is lung qi deficient is conscious of their posture because a slouched, slumped posture and sunken chest will strain lung qi. If there is an emotional aspect to the lung qi deficiency, the person should try to resolve these issues. Now let's talk about lung yin deficiency. Unlike most yin deficiency patterns of imbalance, lung yin deficiency can be both a chronic and a more acute and temporary condition. This is because the lung is a delicate Zhang organ and its yin aspect can be easily injured by dryness and heat. For example, when there is an excess heat condition in the lung, such as an invasion of exogenous pathogenic heat. Concept, this is due to lung yin deficiency giving rise to internal heat, which damages the lung, and the lung is then unable to dominate descending. If the symptoms of deficient heat are not obvious, it is called a lung dryness with injured fluids pattern. Key symptoms, dry cough with scanty, sticky sputum, and symptoms of deficient heat, which result from yin deficiency. Clinical manifestations, dry cough with scanty sputum or scanty, sticky sputum that is difficult to expectorate. A dry mouth and pharynx, emaciation, a feverish sensation in the chest, palms, and soles, afternoon fever, night sweating, red cheeks, cough with blood-tinged sputum, may be annoying, tickly cough at night, hoarseness, red tongue with scanty fluids, a thready and rapid pulse. This pattern is caused by heat dryness, which injures the lung, or by infection of tuberculosis, or after a febrile disease, or by excessive sweating, which depletes the yin fluids, or by enduring cough, which consumes lung yin. Lung yin can be injured by exogenous pathogenic qi, for example, dryness and heat. Exogenous dryness can invade the lung when a person lives or works in a building with a dry interior climate, such as buildings made of concrete. Lung yin will also be injured by a condition of excess heat in the lung. Tobacco smoke is both hot and dry. This means that smoking can be an etiological factor in chronic lung yin deficiency patterns. Prolonged use of the voice can strain lung yin, which can be a problem for teachers and singers. Lung yin will eventually be adversely affected by the same emotions that are involved in the generation of lung qi deficiency, that is, sorrow and melancholy. So here you could see a tongue that has a rather front or lung area on a red tongue without coating. So this is lung empty heat. So to summarize, etiology of lung yin deficiency is hereditary weakness, poor posture which constricts the breath, exterior attack of wind cold or wind heat resulting in impaired lung descending function, prolonged grief and sadness, weakening the lung qi, external or internally generated dryness, etiological factors leading to kidney and or stomach yin deficiency. Possible presenting condition is pulmonary tuberculosis. Signs and symptoms, cough which is dry or with scanty sticky sputum, weak hoarse voice, dry mouth and throat, tickly throat, tiredness, dislike of speaking, thin body or thin chest, night sweating, emaciation, afternoon tidal fever, 5-palm heat. Pulse is floating, empty, rapid, and fine. Tongue, normal color or red and peeled. Treatment principle, moisten the lung, suppress cough, and reach the yin. Acupuncture treatment, we use lung 9 to supplement lung yin, spleen 6 to supplement the yin, do 12 to relieve cough and dyspnea, kidney 6 to supplement yin, benefit the throat, bladder 43 to supplement lung yin, Ren 17 to supplement qi and lung yin, bladder 13 to supplement lung qi and yin, Ren 4 to supplement kidney yin, Ren 12 to supplement stomach yin, and lung 5 to clear lung heat. We needle using the reinforcement technique or supplementation. For lung, kidney, and deficiency, we add bladder 23 and spleen 6. A person who is lung yin deficient should not smoke, and they should avoid others smoke. Living and working in concrete buildings or other buildings or places where there is a dry climate will injure their lung yin. Like a person who is lung qi deficient, a person who is lung yin deficient must be careful not to overuse their voice. In general, they should avoid straining their body and make sure that they get enough rest and sleep. Strong and spicy foods promote sweating and expel qi. The excessive consumption of spicy food should therefore be avoided. This is especially important if there is empty heat, as many spices are also hot. Milk nourishes lung yin, but caution should be exercised as it also can create phlegm in the lung. Let's now discuss large intestine damp heat. This pattern will frequently be combined with other patterns, usually spleen and stomach imbalances. What makes this pattern difficult to treat is that there is yin and yang pathogenic qi, which are bound together. Exactly how the symptom picture manifests will depend on which of these two elements is dominant. Concept: damp heat in the intestinal tract refers to the incapability of the large intestine to transmit caused by damp heat in the intestinal tract. Key symptoms: dysentery or diarrhea with a damp heat pattern. Clinical manifestations: abdominal pain, diarrhea with blood and mucus, tenesmus, which is straining with difficulty, spouting diarrhea with foul-smelling stool, a burning sensation of the anus on passing stool, scanty dark urine, fever, thirst with parched mouth, but disinclination to drink, red tongue with yellow greasy coating, a slippery and rapid pulse. This pattern is mainly caused by summer heat dampness, assailing the stomach and intestines, or by irregular intake of food, both of which can result in generating damp heat, which brews and becomes binding in the large intestine. Damp heat in the large intestine will be defined in an 8-principle diagnosis as an interior excess heat condition. The pattern can arise when there has been an invasion of exogenous damp heat, for example, after the ingestion of spoiled food. In this case, it will be a purely excess condition. Usually, however, the pattern arises in the background of spleen qi deficiency or spleen yang deficiency conditions. This makes the situation more complicated because there will be a condition of interior excess heat that has arisen from a concurrent interior deficiency condition, which will in fact be an interior deficient cold condition if there is spleen yang deficiency. This requires a treatment strategy that will require both tonification and draining at different stages, as well as the clearing of heat and the warming of yang. So damp heat in the large intestine etiology is excessive consumption of hot and greasy foods leading to stomach heat, damp heat in the stomach and spleen, emotional problems like prolonged anxiety and worry leading to spleen qi deficiency. Possible presenting condition would be dysentery, colitis, Crohn's disease. Signs and symptoms: diarrhea with abdominal pain, incomplete defecation, mucus and blood in the stools, stools with an offensive odor, burning sensation in the rectum, tenesmus, scanty dark urine, sweating, thirst but no desire to drink, heaviness in the limbs, bitter taste. Pulse slippery and rapid, tongue red with a sticky yellow coat. Treatment principle: clear heat and disinhibit dampness, resolve toxin. Acupuncture treatment: spleen 9 to resolve damp in the lower burner, as well as bladder 22. Stomach 27 to promote urination, bladder 25 to clear heat from intestine, REN 12 to resolve dampness, stomach 44 to harmonize intestines, spleen 6 resolve damp in lower burner, stomach 25 to stop diarrhea, REN 6 to regulate qi in the lower burner, LI 11 to clear heat, and stomach 37 to clear and disinhibit damp heat. We needle with drainage, and then we add moxa. If there is damp heat in the large intestine, the patient should avoid consuming food and beverages that create dampness, heat, or damp heat. Deep fried foods, alcohol, hot spices, dairy products, and sugar should be avoided completely. Next, we talk about heat obstructing the large intestine. Heat obstructing the large intestine will always be a pure excess pattern of imbalance. All the symptoms and signs will be due to the presence of heat, which desiccates and scorches. This is due to when both dry and heat pathogens and the stool combine internally and result in blockage of the large intestine, and this pattern manifests as an interior excessive heat pattern. It is classified into Yang-Ming Fu excess pattern using the 6 channels pattern differentiation, Qi level pattern using the Wei, Qi, Yin, and blood pattern differentiation, and the middle jiao pattern using the San jiao pattern differentiation. Key symptoms: distension, fullness, rigidity and pain in the abdomen, constipation with an interior excess heat pattern. Clinical manifestations: high fever or late afternoon fever, distension, fullness, hardness and pain of the abdomen or around the umbilicus, which is aggravated by pressure, constipation or foul-smelling stools, sweating, thirst or mania, coma and delirium, scanty dark urine, red tongue with thick and yellow coating or thorny tongue, and a powerful, deep, and rapid pulse. This pattern is caused by an exuberant heat pathogen and excessive sweating, or by incorrect treatment with medicinals to induce sweating, all of which leads to an excessive dry heat pathogen which binds with stool and blocks the intestinal tract. Heat can arise in the large intestine due to prolonged intake of substances that have a hot energy, such as lamb, alcohol, chili, and fried food. Exogenous pathogenic qi can penetrate into the Yang-Ming aspect and generate heat in the large intestine. So heat invading the large intestine, etiology would be excessive consumption of heating and or drying foods, externally contracted febrile disease manifesting as Yang-Ming pattern, also known as disease in the qi aspect, possible stomach heat underlying. Signs and symptoms: constipation with dry stools, abdominal pain with dislike of pressure, a burning sensation in the mouth, dry tongue, burning and swelling of the anus, scanty dark urine. Pulse is full and rapid, tongue, thick yellow dry coat. Treatment principle: clear heat and free the stool. Acupuncture treatment: stomach 25 to regulate the intestines, Li 11 to clear heat, stomach 44 to harmonize the intestines and clear the heat, kidney 6 to supplement yin, promote fluids, bladder 25 to move large intestine qi, stomach 37 to regulate intestines, clear heat, and Li 2 to clear the heat. We needle using the drainage method. If there is heat in the large intestine, the patient should avoid consuming food and beverages that are hot in their energy. Spinach, bean sprouts, bananas, cucumber, fig, rhubarb, and bamboo shoots all drain heat from the large intestine and are therefore beneficial. Spinach is especially salutary because it moistens and lubricates the large intestine. This will enable the stool to move more easily through the large intestine. Next is large intestine dryness. This imbalance pattern is a precursor of yin deficiency. There will be perceptible symptoms and signs of dryness, but not decidedly yin deficiency symptoms and signs. This is due to deficiency of fluids in the large intestine, failing to moisten the intestines, and then this creates dry stool and difficult defecation. Key symptoms: dry stool with difficult defecation accompanied by a yin fluids deficiency pattern. Clinical manifestations: dry stool with difficult defecation, defecation once every several days, a dry mouth with foul-smelling breath, sometimes dizziness, a red tongue with scanty fluids and yellow dry coating, and a thready and choppy pulse. This pattern is caused by innate yin deficiency or by yin blood deficiency in old age, or by vomiting and diarrhea, chronic diseases, the late stage of warm heat disease, which consumes and injures yin fluids, or by blood loss, or from excessive bleeding after delivery, all of which can lead to exhaustion of fluids in the large intestine and thus failure to moisten and nourish the large intestine. This pattern may be due to exogenous dryness, which can arise when a person is living in a very hot and dry climate. The most common cause, though, is irregular diet. Eating late, eating while working, irregular eating, or eating while stressed will all injure the stomach yin, which is the root of qin yin. So large intestinal yin deficiency with dryness, the etiology would be lack of blood and body fluids, with underlying blood or yin deficiency leading to exhaustion of fluids in the large intestine. A warm, dry climate, postpartum blood deficiency, liquid depletion in the aged and in enduring and severe diseases, externally contracted febrile disease. Signs and symptoms, dry, hard stools, which are difficult to move, dry mouth and throat, thin body, bad breath, dizziness, generally no abdominal distension or pain. Pulse is fine. Tongue, dry and peeled, can be pale or red. Treatment principles, supplement the yin, promote fluids, regulate intestines, and move stagnation. Acupuncture treatment, stomach 36 to promote yang ming fluids, kidney 6 to supplement yin, promote fluids, stomach 25 to regulate the intestines, and bladder 20 to benefit spleen transformation, bladder 25 to regulate the large intestine and transform stagnation, spleen 6 to supplement yin, promote fluids, ren 4 to supplement yin, promote fluids, bladder 17 to harmonize stomach qi, bladder 21 to support center qi to supplement deficiency. We needle with supplementation and maybe moxa if needed. When there is large intestine dryness, the patient should eat foods that are moistening and lubricating. This includes foods that are rich in oils and fats, such as nuts and seeds, as well as vegetable oil. Prunes, bananas, avocados, spinach, and plants from the cabbage family moisten and lubricate the intestines. Finally, we have large intestine deficient cold. The difference between this pattern and damp cold in the large intestine is that this is a deficient pattern of imbalance, whereas damp cold in the large intestine is an excess pattern. The stools here will not be explosive and there will not be cramping pain in the abdomen. Instead, the pain will be a dull nagging pain that is not alleviated by the passing of a stool. This is due to yang deficiency of the large intestine. Key symptoms, irregular bowel habits like loose stool or dry stool with symptoms of a deficient cold pattern. Clinical manifestations, rumbling intestines, dull abdominal pain, preference for warmth and pressure, lingering diarrhea or fecal incontinence, possibly even tenesmus, rectal or anal prolapse, aversion to cold and preference for warmth, cold body and limbs, fatigue, lack of strength, profuse and clear urine, constipation, a pale tongue with a white slippery coating, a deep and weak or deep and slow pulse. This pattern is caused by innate yang deficiency or by overconsumption of raw and cold foods or by chronic diseases or chronic diarrhea which damages yang qi. This pattern can arise due to excessive consumption of food and beverages that are cold or cooling, both energetically and thermally, or from prolonged exposure to climatic cold and repeated invasions of exogenous damp cold. Physical and sexual overexertion can also be involved in the generation of the underlying yang deficiency patterns. So large intestine deficiency cold, the etiology would be excessive consumption of cold and raw foods, prolonged exposure of the abdomen to cold weather, probable underlying spleen kidney yang deficiency. Possible presenting condition would be chronic enteritis, chronic dysentery. Signs and symptoms, loose stools resembling duck droppings, dull abdominal pain, pale urination, cold limbs, borborygmi, lower backache, poor appetite, aversion to cold. Now let's make a comparison between spleen stomach yang deficiency and large intestinal yang deficiency. In spleen stomach yang deficiency, the stools contain undigested food. There is poor appetite, oppression in the abdomen after eating. In large intestinal yang deficiency, the disease is in the lower rather than the middle burner, accompanied by diarrhea and borborygmi, and may have constipation rather than diarrhea. Pulse, deep and weak. Tongue is pale, thin tongue coating. Treatment principle, stop diarrhea and supplement qi and yang. Acupuncture treatment, stomach 25 to stop diarrhea and pain. Stomach 36 to supplement spleen qi. Bladder 20 to supplement spleen qi. Ren 12 to fortify the spleen. Ren 6 to supplement qi and stop chronic diarrhea. Stomach 37 to stop chronic diarrhea. Liver 13 to transform stasis, and bladder 25 to supplement the large intestine. We needle with supplementation and moxa. When there is large intestine deficiency cold, it is beneficial to consume warm, cooked, or baked food. It is advisable to eat foods that have a warming energy. Baked root vegetables, stews, soups, lamb, chicken, onions, and leeks are all examples of warming food. Spices that will be beneficial are cloves, cinnamon, ginger, basil, rosemary, and nutmeg. Thank you very much for your attention.